Record.
The urinary system is composed of the kidneys, ureters, bladder, urethra, and the blood sources to it. Its overall function is to remove waste from the body by filtering the blood. This system is crucial for maintaining the body through regulation of body fluids and blood pressure, and by removing harmful and potentially fatal waste from our bodies and warning the body of potential dehydration.
The kidneys are a reddish-brown bean-shaped organ that are approximately 4 inches long and approximately about the size of a fist. There are 2 kidneys. Since they are located behind the peritoneal cavity, they are considered to be retroperitoneal. They are located on either side of the vertebral column. Simplified, the kidney's main job is to remove waste and water from the bloodstream and to maintain a balance of body fluids. However, there is nothing truly simple about the structures or the physiology of the kidneys. Blood enters the kidneys through the renal artery at the hilum, which comes directly off the aorta. Once the blood arrives to the kidney, the renal artery begins to branch and form the segmental arteries, which then branch to form the interlobar arteries, which branch again to form the arcuate arteries, which arch above the renal pyramid. The arcuate arteries then branch into the cortical radiate arteries that extend into the renal cortex. Extending off of the cortical radiate arteries are the efferent arterioles. The efferent arterioles extend into the Bowman's capsule, or renal corpuscle, which houses the glomerulus. It is within the Bowman's capsule that the enclosed capillary ball allows solutes to enter the Bowman's space and then enter the nephron as filtrate. Each kidney has around 1 million nephrons that, if extended, would be around 85 miles in length. Once the blood has passed through the glomerulus, it exits through the efferent arteriole, which then ultimately carries it out of the kidney via the venous system and is ultimately returned into the inferior vena cava. The nephrons are composed of 4 different parts. The proximal convoluted tube, seen here in yellow, is where most nutritional absorption occurs, followed by the loop of Henle, seen in light blue and green, where reabsorption of water and ions occurs, and it also controls concentration levels. The distal convoluted tubule helps with more dilution and regulates potassium, sodium, and pH, as seen in the upper yellow section. And finally, the collecting tubule, seen in orange, that collects filtrate from other tubules, which also regulates sodium levels for the last time. Each nephron is surrounded by the capillaries, which helps with the task of filtration and absorption, which takes place in the nephrons. The collecting tubules then drain into the minor calyx, which then drain into the major calyx, and finally drain into the renal pelvis, which connects directly to the ureters.
Each person has 2 ureters, each connected to one of the kidneys. They're each 8 to 10 inches long, and they transport urine to the bladder. They're lined with muscles that contract and release continuously all day, releasing urine into the bladder every 10 to 15 seconds.
The urinary bladder is a hollow muscular organ in the body that collects and temporarily holds urine until it is ready to leave the body. Think of the urinary bladder as being like a stretchable bag. The bladder is like a balloon, and it swells into a round shape when it gets full and when it gets smaller when it empties. A normal bladder completely empties every time you pass urine, and it does not leak. The average person passes approximately 1.5 liters to 2 liters of urine in 24 hours. The bladder is a stretchy muscular bag that sits just behind the pubic bone. The bladder is about the size and shape of a pear.
place where urine leaves the body. It is both present in male and female bodies. The first place for urinary tract infection is here because of the exposed opening to bacteria like E. coli. In men, it is also used for reproduction and can be up to 8 inches long. In women, it can be 1 to 2 inches long. This contributes to the greater risk for urinary tract infections in females.